A simple test given over the phone could help cut down on unnecessary visits to hospital emergency rooms. That's the lesson from a new study involving patients with a disease called myasthenia gravis. Teresa Snow explains in this week's Focus on Your Health.
Focus on Your Health is sponsored by MU Healthcare.
Research shows that a breathing test given by nurses over the phone could be a good way to triage patients with MG, helping them to determine the right place to go for care. Sammy Dodd is happiest when she's spending time with horses.
I've just come out here as much as I can because, I don't know, it's just like a safe place.
She's been volunteering at stables long before last year when her day-to-day life became a little less peaceful. Sammy was diagnosed with myasthenia gravis, an autoimmune disease in which the body produces bad antibodies that block the connection between her nerves and muscles. She gets a bi-weekly infusion to help manage the symptoms of MG.
Some days you just can't walk, can't really talk, can't eat, can't breathe. And then other days you're like, okay. It's kind of like an invisible disease.
At University of Missouri Healthcare, Dr. Raghav Govindarajan wanted to make things easier on patients like Sammy when they experience a flare-up or MG crisis.
Neurology and Sleep Disorders Clinic.
He trained his nurses to administer a test called the single breath count test over the phone. When a patient with MG has trouble breathing, they call the clinic. A nurse will ask the patient to take a deep breath and count for as long as they can without exhaling.
Just count numbers as best as you can, as far as you can go.
Using this test, nurses can tell how well the patient's lungs are working.
I think for patients, the biggest benefit is they can call the doctor's office, get a triage by the phone, and decide whether to go to the ER or not.
You're feeling like you're a little bit short of breath?
The test isn't new, but the method is. And in a pilot study, Dr. Govindarajan found it's reliable, too. For Sammy, it's been a relief to stay out of the ER when possible.
It was so much better. I don't have to go in.
And as she learns to live with MG, she'll cherish every quiet moment before heading to college in the fall. The cause of MG is unknown, although some people may have a genetic predisposition. There's no cure, but treatment can help with certain symptoms, such as muscle weakness and drooping eyelids. With Focus on Your Health, I'm Teresa Snow.
Focus on Your Health has been sponsored by MU Healthcare.